In this position, with the patient in supine, we are now able to examine and measure elbow extension. In this position, I've placed a towel underneath the humerus to allow for full movement of whatever the patient's available extension range is. Our landmarks are going to be our moving axis of the lateral epicondyle of the humerus. Our proximal or stationary arm will be towards the tip of the acromion or the lateral border. And our moving arm goes from our epicondyle to the styloid process of the radius. In this position, we are expecting a neutral or 0 degrees of extension, but in many cases, with stability in this position, you will feel a restriction to movement at some degree of flexion. If that is the case, we would utilize our landmarks and take our measurement of extension in that range. In this particular case, the patient is going to extend, and as she attains 0, you actually see a degree of hyperextension at the elbow in that degree, which is not necessarily unexpected. We will then use our goniometer to measure that degree. There we are at our axis of motion. We're going to use our stationary arm with our proximal landmark, and then we will align it with the process here, and that will give us a degree of extension for the elbow.